Pharmacology, Module 1, Discussion Topic 1. You arrive in an outside hospital and are reported that the patient is on 10 of dopamine. You also notice the standard concentration infusion bag with 400 milligrams of dopamine and 250 of saline is connected to an IV pump that reads 10 milliliters per hour. What would you do professionally as well as clinically in this case? How professionally and clinically should you proceed? Well, the dosage doesn't seem off after doing the calculations and kind of seeing what the normal range of giving dopamine is. It's about 2.6 milligrams or micrograms per kilogram per minute, which is within. It's kind of actually a low dosage. I don't know why they're receiving it. I'm sure. And I don't know how long they've been receiving it. So really, and if the desired effect has taken place, if it's titrated. So because you can continue to up the dosage until it gives you the desired effect. So I'd have to know. Basically I wouldn't stop. I wouldn't sit there and just be like, oh, okay, cool. Even if I asked and they said, hey, what's the dose? And they reply, that's the dose. And then the dose and the rate are both 10. The rate's 10 mils per hour. That's a rate. 10 is not a rate. If I'm going to be taking responsibility for this patient, I'm going to need specifics. And I'm going to say, hey, this is 10 mils per hour, correct? Of course, you can see it on the pump. I can read. He might think I'm stupid, but I'm the liable one here, so I'm going to definitely talk to him. The dose doesn't make sense, though, to say the dose is 10. In that, the concentration on that is 1,600 micrograms per mil, so it's not the dose, or it's not the concentration. The dose isn't even 10 micrograms per 10 micrograms per kilogram per minute, which is kind of usually how dopamine's done as far as doses. So that's not correct either. So I'd have to ask more questions. Why was he getting? What was the physician's orders on this? Why is it at this rate? And I might just go talk to the physician. Whatever I need to do, I'm not going to be mean about it. I just need to make sure that I need to ask the correct questions. How much does this patient weigh? Because that determines how much dopamine he needs to be on, he or she or they need to be on. And then I need to know what the medical history is and know why that it's being given to them, so that I can make sure that they maintain the desired effect of the drug, and that if I need to up it for any purpose, that I can do so within range, obviously, of what the safe range is for administration and dosage. And then just make sure I have all the information I need. Weight, the orders that it was given, the desired effect that we want from the drug, and then I need to make sure, how long are we going to be traveling? Are we transporting this patient? I'm not really entirely sure why we're at the outside of the hospital and we have the patient, if we're moving them, if they've had a surgery and they're being transferred to a different place, if they're being transferred because they need to go to a different facility for whatever reason. But just gather more information, and if the whoever's doing the patient transfer, I'm assuming, I don't know who it's going to be, but anyways, just find more information and make sure that you know what you're doing before you leave with that patient. If you feel that it's an unsafe dosage for whatever reason, if you look at it and go, oh, that's not right, just to begin with, you stop it, and then you ask questions. As long as, you got to be careful, obviously, as long as you've done the transfer, and you got to make sure you take care of your patient. If it doesn't look right, do what you need to do. But that's what I would do.